So here we are today at the E1 Suite and Spa with Dr. Krish Rawal. Hi, Krish. It's really nice to be here with you. We're not going to give a COVID update today.
No, no. I'm very pleased to say. Very pleased to say.
Krish and I worked together actually on a program many years ago, 2015, called From Fat to Fit, where I managed to lose 20 kilos. I have put on a bit of weight, but maybe not all the weight. But we're going to be talking about keeping healthy. Krish is still a GP at the GHA, at the Primary Care Centre, but he's also medical director for the Infinity Group. And this is why we're here today. We're going to talk about what the Infinity Group has to offer the Gibraltarian public or anybody who comes to Gib and just wants to keep fit, keep healthy and live longer, which is actually...
And that's really the point, isn't it? So, of course, I remember very clearly the program that we went through.
Yes.
We did all regular updates. We were checking blood tests. We were checking all sorts of things. But what's very interesting about it is exactly the message which I think you very, very well took home from that, which was to keep going, to live healthy longer, just a little bit. I see you on your bicycle.
I know.
I see you exercising.
I was going to say.
It's fantastic to see, because that was quite a long time ago.
It was 2015 when we did that.
Yeah.
Yes, I think a lot of us have put on a bit of weight, some more than others.
Yeah.
I remember one of the girls lost a lot of weight and got off all her medication.
Yes, amazing.
I mean, this was a huge thing to take from keeping healthy and exercising, because you can come off some. She was a diabetic, so I remember we talked about all that. So I keep very healthy. I swim a lot.
Good.
Yeah, I've had a double knee. Double partial knee replacement.
Not the knees. No, the swimming. Yeah, not the knees.
But that's good. You see, I'm limited a bit with the exercise that I can do. So I do swimming, walking, and cycling. Yeah. But you also keep fit as well.
Yes, and for me this is incredibly important. So living healthier longer, which is like you said, is our theme, is really, for me, exercise. I'm a GP, as you've already mentioned. I mean, I spend my days caring for people, chatting to them about medications, adjusting medications, talking to them about particularly chronic diseases, blood pressure, diabetes, issues with weight, issues with breathing, all of these kind of things. But the key really is the body is an incredibly complicated but very, very, very proficient machine. It will look after itself if you look after it. Half of the issue, I think, with the living healthy longer message is that some people just don't know where to start. So they look at this enormous mountain to climb. They know they could get fit. We know that exercise is good for you. There's no question. There's been published over 100,000 pieces of research to prove that exercise is good for you. It's irrefutable evidence that it does. But it's one thing to read evidence or to read it in the paper or in the news on the social media, say exercise is good for you. It's another thing to do it.
To get off your sofa.
And sometimes the hardest exercise is putting your trainers on in the first place.
Yes.
Just getting there and just thinking, you know what? Life is busy. I've got 1,000,001 other things to do. I do not have the time to shoehorn exercise into my day. So the message for me always has been a little bit every day.
Yes.
And the reason I say that is that you've got to turn it into a bit of a habit. So if you are not a treadmill person, but you enjoy weights, or if you're not a weight person, but you enjoy the cardiovascular side of things, with the cross trainer, for example, the treadmill, or with the classes, and of course they're amazing classes, and the nice thing about the classes is energy and lots of other people. But you have to choose your exercise that you enjoy.
Yes.
Do a little bit. Don't say, tomorrow. I had a very, very, very good friend who would do nothing for months. And then she would go onto a rowing machine. She would do an hour on the rowing machine and then be surprised for the next week that she couldn't walk. So, and I always used to say, start with 10 minutes. It doesn't seem like very long, to the point where it can actually take you longer to put your trainers on than it is to do the exercise. It doesn't matter. You're doing it every single day, gradually. And it does two things. Firstly, it gets it into habit.
Yes.
It's easy once something's a habit. And then life itself will kind of mold around that habit.
I discovered exactly that when I lost the weight and I started cycling and swimming regularly.
Yes.
And I've kept it up. And it's nearly 10 years now.
Yes.
And I go swimming. I mean, look at the amazing view we have here, but I go straight to Eastern Beach or
Good.
Sandy
Yes.
Bay.
Fantastic.
And
Yeah.
it's wonderful.
But of
keep it
course,
up.
for you, if,
Yes.
if for example you're swimming, you if I said to you today take up swimming and you'd never done it before,
Yeah.
it would be a very difficult
Yeah.
ask to tell you to go and jump into the sea, freezing cold because
Yes.
it's almost December, to swim now. But because you're in the habit, because now not doing it is harder because it drives you mad on the days when you can't exercise because you need it for your energy, for your well-being,
Yeah.
just for your day to set you up properly. And that has been proven by doing little bit,
Every
little
day.
bit, and
Yeah.
then gradually increasing.
Well, tell me something that when you reach 50, this is another big thing. So
Yeah.
I'm 54.
Yeah.
Things start to go wrong with your
Yes.
body.
Yeah.
I think it's just your age. It's
Yes.
just age related.
Yeah.
So, and you get a combination of things happening. So arthritis, maybe diabetes comes. What can people do so these things don't happen? How can they prevent?
Correct. So again, we
things.
go back to just regular exercise every day.
Yeah.
It improves your health in every way. It improves your health from the point of view of your heart health, your lung health. It does help you with weight management, of course, if you exercise, and if you're better with your weight, you're either less likely to get diabetes, or your diabetes is less, or you won't develop it at all, or you can, as you mentioned, one of the other
Yes.
participants
Yeah.
in our program, she shook it off completely.
She did.
And the evidence is very clear to say that if you exercise and you lose weight, type 2 diabetes, you can reverse it completely. The NICE guidelines in the UK, for example, talk about arthritis, and actually top of their list of ways to manage arthritis is exercise. Because, for
Yes.
example, knees,
The
and you
worst thing
talked
you
about
could-
your
yes,
knees.
my knees.
And of course, when your joints are aching, the last thing you want to do is go
exercise.
exercise. Yes.
Yes.
And actually, a lot of people will tell you don't. Don't exercise because it's bad for your arthritis. Actually, for example, take the example of your knees. If you exercise your legs and you strengthen your quads muscle, the muscles take the weight off the knees and the pain gets less. And the more you strengthen them, even for example, if you use the machine where you do leg extensions, that's enough. Because of that, it starts to strengthen the quads muscle. Walking is best as well. Walking, for
Yeah.
example, on a treadmill, which I actually really enjoy, because sometimes I don't have time to go out and do a proper formal walk or a hike or a run.
Yes.
So I love to do the treadmill because it's very, very simple. Trainers on, onto the treadmill. I've done my 20 minutes or half an hour, what it is. I've done my exercise, so I feel better for the day, but also for my own mental well-being, it clears my
Well, I
mind.
was going to touch on that as well. And
Yeah.
also the diet. I mean, diet has a
Yes.
lot to do with it as well. And a lot to do with your mental health as well.
yeah.
I've been discovering more and more that the healthier you eat, the better your
Yes.
brain works, no? And the better you
Completely, yeah.
feel.
Yeah,
But from
so I agree. Now, food and diet is a really big thing for me. As you probably, you and I have known each other a long time, so you know that I'm very much into not only the medical side of things, but I'm very much into the well-being, the holistic stuff,
Exactly.
which is the whole body, so mind and body, health, everything that goes with it, and diet. And I talk to a lot of people about their diet, their weight, and those kind of things every day. And in fact, I'm not particularly hard on people. And the reason for that is that I do recognize how difficult it is, in fact, to have a healthy diet sometimes. It really is. For example, here in Gibraltar, we are quite dependent on a small number of food suppliers, for example.
Yes.
And some of that food has been imported into Gibraltar. In fact, quite a lot of it. And so
Most of it, I think.
Yeah. So in fact, a lot of it has to be either frozen or has to have some sort of preservative or something or additives in it. So that side of things makes something, you might aspire to eating organic vegetables and this and that, and maybe you'll go into Spain and go to one of the markets at the weekend, but it's not sustainable during the week when you've got a busy week.
Yeah.
And sometimes when you're busy and when you're stressed and when you're tired, the body's natural reaction is to eat something sugary and salty. So sometimes what I do is I try and flip things a little bit. So people say, I've got a diet because I need to lose weight. I've got to exercise because I need to lose weight. And I actually try and change the mindset a bit. And it seems like the silliest thing, but I say, you know what, throw it the other way around and just say, if I exercise, it means I can eat a little bit of what I want. So don't do it the other way and say, no, I can't eat what I want. You just throw it the other way and say, you know what, I'm going to do my exercise today.
But I
And
can
then
have a
when
little bit of chocolate.
I can have a little bit of chocolate or a biscuit or a little
Yeah.
bit of cake or a dessert after dinner and things like that. So flip it the other way around.
Yeah.
But very much with the diet is very much like exercise. I say a little bit every single day and then gradually increase. Exercise becomes a habit, then becomes more than a habit. Sometimes with some people, they're very quick to accept it, that their exercise is almost an addiction, which is fantastic.
That's the other way.
Yeah, the other way, a little bit too extreme, but amazing, because some of these people, some people who are addicted to this exercise achieve incredible things, and you can tell these people. They're really doing well.
They become a bit obsessed with it.
Yeah, sometimes the obsession is a little bit too far.
A happy balance.
A balance with everything. But diet the same. So diet very much, and how you're eating also becomes a habit. So I say to people, if you are somebody that eats a lot of sweet things, for example, or perhaps a bigger disaster is snacking late in the nighttime. A lot of people do that. It's a disaster.
I know, especially if you have like dinner early and then you're like 10 o'clock and you're like watching, and then all the adverts on TV are all about eating
of course they
chocolate.
Are, and you're sitting, you're comfortable, you're warm, and dinner was a couple of hours ago, and you think, oh, I'll have a cup of tea and a chocolate biscuit. It's a disaster because it sits on your belly and you essentially absorb more of it. So what I say to people is just try and change the habit very gently. You can't literally say today, right, I'm never going to eat sweet things again. 2 weeks down the line, you won't be able to sustain it. It's not possible. So maybe during the week, don't have those sweet things, or don't have them late, or include a sweet thing, or whatever your favorite thing is in your meal and not later in the evening. But then relax at the weekend. Have a little bit of something you want.
Treat yourself and look forward to it.
Yes, correct. And that might not necessarily be something sweet. It might be something savoury. It might be, some people just like to eat cheese and biscuits, for example, or have a glass of wine. But it's very much balanced, exactly what you say.
Tell me something. Do we have a problem in Gibraltar with obesity, with people with diabetes and other related to diet and exercise and well-being?
Yeah, I think, but I don't think that's specific to Gibraltar. I think that the kind of sugar crisis, the diabetes crisis, and they use the word crisis because it's a Western world thing. It's a very, very, very increasingly common thing. If you read the health reports that the Public Health Department issue, you will see that a big proportion, at least 40% or more, of Gibraltarians or people who live in Gibraltar, are overweight according to the figures.
The BMIs.
Yes. Yeah, but I think that's a product of diet and exercise. But it's definitely just perhaps in Gibraltar the little extra nuance is that Gibraltar's a small place, and it's very easy to jump on the bike and to and from because we've got that ease, or jump on the car. But the irony, of course, is although maybe because it's a small place, it doesn't encourage exercise. Because it's a small place, it's easy to walk everywhere. Yeah. And of course, now look how amazing the roads have become. We've got cycle lanes and everything. Oh, it's fantastic. Fantastic, yeah, absolutely. I love to see and every time I look, a little bit more. So it couldn't be easier, actually.
Yes. So as the Infinity Group's medical director, so tell me a little bit about your role and how the Infinity Group are helping people and can help you. If anybody is watching this, how can they get involved and maybe join a gym or...
Absolutely. So of course, my role as medical director is really to provide that little extra nuance. So Infinity, as the group, provide amazing gyms, and the gyms have every single machine you could possibly want, and of course they have a lot of classes. And as we mentioned earlier, sometimes going to the gym can be a bit daunting if you're not really sure about the machines. The great thing about Infinity is that they have a lot of trainers. You can easily identify them. So you can go in, you can ask advice. How do I use this machine? And in the past, I'm the first to confess, I've been using a machine completely disastrously wrong, and only been very short little margin away from not doing it right, and potentially hurting myself. And somebody's always come up to me and say, "Look, can I please suggest you try it like this?" Yes. So very supportive. The classes are incredible. And, some people really, really do well with classes.
Yeah, what I did want to say is that there are classes for everything. So I'm limited because I've had the knees and all the rest. So exercise is still important. So there are things that can be adapted to whatever needs you have, And every gym has different, I suppose.
And that's the nice thing about it. Yes. And like I say, some people are a little bit uneasy about going to gym, but the key really is there are people who are very, very competent in the gym.
Yeah.
But that doesn't mean that somebody who's new to a gym or new to classes should be put off. In fact, you can just speak to a member of staff and say, you know what? I'm really interested in a class because I like the structure that goes with a class. I know that at 5 o'clock every single day or 3 times a week, this class is going to go on. I know there are other people there. It's going to, I'm bound to, because Gibraltar is great for the fact that we know everybody.
Yes.
So you're bound to see somebody there that you like. So they're going to message you saying, why are you not at the class? Are you coming? Etc. So it gives you that extra push to go to the classes. And you can speak to them and say, I fancy a really, really high intensity class. I fancy a reshape and rumble class. I fancy a spin bike class. I fancy something Pilates related,
something
yoga
a little easier.
related, something a little bit slower, gentler, that might lead into something, more intense in time. So you can gauge it and choose what you want. And the great thing about Infinity is that they don't just have one gym. They have lots of gyms. Yeah. Each of which has just a little particular nuance different to the others, bound to be one near where you live, because of course that makes, or where you work, which makes life so much more convenient. The facilities are great. You can go in, you get changed there, you can shower there, it's ideal.
Reading about them, Infinity, the multi-club membership, where if you live in a place and there's a gym near you and then you go to work and you want to go to the gym there, you can get a club membership and use all the different gyms.
And where else are you going to get that?
It's so cool. Everywhere wherever you live in gym, there's an Infinity gym near.
Yes. And actually, people that exercise during the day at work, for example, lunchtime is a great example, straight after work. That little time, it might only be half an hour. It might be longer, 40 minutes or an hour, but it's very strict because you've got to finish work, you've got to finish up, you've got to go to the gym, you've got to get back. You don't want to be hot and sweaty. You want to be changed out. You want to be fresh for work in the afternoon, or you want to be fresh to go home to do do things at home, to look after family, to pick up the children, whatever else it is you need to do. So the beauty of it is you can go in, you can do your thing. And like you say, with a multi-gym membership, you might find at the weekends that the gym that's near home suits you better, and that the gym that's near work is perfect for those quick
half an hour, 3/4 of an hour. That's all. Going. As you were saying before, that's really all you need. Not like a little bit every day. Yes. And once you start doing the changes this is what I found, the little changes in your life, it just becomes like a routine. Completely. And you can't do without it. This is what if I haven't been on my bike or done some walking or something, I'm like, I've got to get moving. You start feeling it. Yeah, absolutely.
And the great thing about it is that many of us work in office.
So we're sitting all day. Yeah.
And, for example, in my job, up until very recently, I would literally get out of my seat, walk down the corridor, call a patient in and walk up the corridor with them. Unfortunately, I suppose fortunately from the point of view of timing of the clinic, but now unfortunately for me, there's a call bell. So the patient will walk up and I'm still sitting
there
on my chair, lovely warm chair.
Yeah, so after 2 hours of that, claro, you feel a bit like,
I need to shake it out. I need to, so perfect. Up, done, and I'm back for my clinic.
Do you think people in gym are living longer? I mean, you see a lot of grandparents looking after young kids, so that keeps them young because they're looking on. There's a lot of young people going to work and having their parents looking after their children. Yeah. But as stats, do you know any stats of whether we are living longer here in Jib and the lifestyle and all that?
The statistics are showing, interestingly enough, the statistics are changing with every kind of year that we look at these statistics. The statistics are changing such that, and it depends on how you present them, but the statistics are changing such that essentially the proportion of the population who are retirement age and beyond is getting bigger.
Yeah.
But the key with that one is is the good news, or the better aspect of that is it's not simply that we just have a larger proportion of population who are beyond retirement age who are older, but are older and not particularly strong or not particularly vital. We have a bigger proportion of our population who are, yes, older, but still fit.
Yes.
Still, like you say,
Yes.
babysitting for the grandchildren, but more than that, but are traveling, who are probably still working actually in some way, shape or form, or doing or enjoying. And this very neatly comes back to what you and I started with, which is living healthier for longer. So yes, you want to be healthy because it's great for your body. It's great for your well-being and for your mental well-being. It keeps you strong and fit when it comes even just to do your job. It's better because if you're not very well, you're going to get coughs and colds. You're going to be sick all the time, off sick all the time. But if you're doing that little bit of exercise, increasing your exercise, your enjoyable exercise, and you've been doing it for years, you will get to a point where you can genuinely say, I'm looking forward to my retirement, not because I'm literally just going to sit in a pair of slippers. I'm looking forward.
Yes, because of all the things you can do with your not having to work.
Yes,
you can get out there
I am fit
and see the
and
world,
I am well,
of course.
and I can now spend more time.
Yeah.
I can spend more time exercising or doing some kind of sport that I really, really enjoy. I can take up a new sport because I have the time now, but I'm still fit. I can go traveling. I can enjoy my children and my grandchildren. I can enjoy my friends.
Everything.
So the world is, because half of that issue is, and I know we're all working hard, and everybody who's working laments the fact that they don't have enough time to do the things that they want to do.
But I think that is prioritizing your day.
Yes.
Because we all tend to say a little bit, oh, I don't have time. I can't go to the gym. I'm working. But actually, if you really want to do it, you do it. If you really want to talk to someone, you have time for that person.
Yes.
So you have to prioritize your day and make it a point of spending.
But very interesting. So just as a little slightly off topic, but a little aside to that one. So when we're talking about people who are living longer and living older, so the average age now, the average kind of life expectancy for women is more than 85 expected, not an exception.
Yes.
And for men, 80 and beyond.
Men, it's still less.
Yeah, always less. Yes. But that's a physiological thing. So that very interesting little fact is because for the majority of their lives, women are protected by their primarily estrogen hormone. It's an amazing hormone and very protective over your heart health, your brain health, your lung health, your general health. And men, of course, don't have that. So men, by and large, if you look at the statistics, have a slightly increased risk of heart problems, of strokes and things like that, just because it's not protective.
Okay.
It seems very simple, very simplistic way to look at it. But so there's going to always be that discrepancy, again, proving the fact that the longer you're healthier, the longer you live, essentially.
Yeah.
But there's always that little subtle difference. Of course, women, once they go past menopause and their estrogen levels start to fall, they unfortunately kind of come back into the world of not having that protection. So of course,
but you can slap it on like I do.
Of course you can, yes.
And it
you
works
can.
absolutely.
Perfect.
Yes.
Yeah.
I really notice the difference.
Yes, because of course you can notice your vitality is maintained. And
so
things.
Do you think, seeing as we're talking about the Infinity Group and what they have, Infinity Aesthetics in the Ocean Village Promenade.
Amazing
it's an amazing place.
Yes,
I've been
wonderful.
twice. We've done 2 little podcasts already.
Good.
People want to look younger.
Of course
People are going because there's lots of treatments where not only if you feel good and you're doing all this exercise and you're losing weight, you can have treatments to make yourself look better. Do you think more and more people are doing that as well? And
absolutely, because it comes when you're starting to feel better.
Yeah.
Why not look a little bit better as well? And not necessarily even to look younger. Although some people would like to look younger, but if they've had a lot of stress in their lives, particularly if they've had a very, very busy life or a very difficult life, sometimes you can see that they've worked hard for their lives. You know what I mean?
Yeah.
The amazing thing now is that there are so many more options open. In the past, you go to an aesthetic clinic, like a spa and aesthetic clinic, and you might have some kind of rejuvenation, facial treatment. But now, of course, even things like fillers and Botox and these kind of things.
You can have at lunchtime.
You can have at lunchtime.
Incredible.
And they're much more refined and perhaps much more subtle than they used to be.
As a doctor, would you recommend? I mean, is it all right to have these things? What do you think?
Well, there's no reason not to.
Okay.
I mean, clearly, if you have any worries or concerns about some of these things, then, of course, have a conversation with your own GP or with your own doctor and talk about it. But the one thing I can say is that Infinity, incredibly professional as an as a spa, as a clinic, very professional, and they are very good at going through with you any health concerns, any worries, and they certainly wouldn't, if there's a treatment that perhaps they wouldn't recommend, then of course they're going to talk to you about it. They might advise that you go and see your GP first before you go ahead and do those things, because really the key here is healthy, well, safe, always, because we always want people to walk out of the gym, to walk out of the aesthetics clinic feeling good, and actually not only feeling good but being good inside. So the aesthetic side is very important for people. For some people, they're not bothered. They're really not bothered. They're happy to feel good inside, and that's fantastic. But if you want that little extra so that when you look in the mirror, you can see not only the hard work that you've done, but you can see yourself looking better. And perhaps there's something that over your life you've wanted to correct. And what better place to go to than somewhere where they've got every single machine that you want, from facial treatments to even down to the one which is getting massive reviews at the moment, which is the Tesla chair for the pelvic floor.
I've tried it.
Yeah, it's amazing.
I've had a few sessions. It's really made a difference.
And pelvic floor is a very interesting one because everybody knows to exercise their pelvic floor. Everybody knows, but nobody does it. Nobody ever does it. And the interesting thing, it has
exactly right.
It's a nothing. You can literally sit there and do it while you're watching the TV. But nobody does it. So the best thing about it is that you can go and you can sit on this chair. You can do months worth of pelvic floor in one go. I'm getting a lot of feedback from a lot of patients actually, who men and women. It's not, pelvic floor is not just for women.
No, we had this whole conversation. We've done a podcast just on the chair.
And
it's amazing.
Many people have noticed so quickly changes in terms of just
their sex life.
Yes, of course.
I don't know if they talk to you about their sex life, do they?
Of course
do they?
Yeah, people talk about everything.
I won't ask you anymore.
No. That's probably what it says. But yes, of course they do.
Yeah, because that is one of the things that it's good for.
But it's also a very pelvic floor, particularly, and not being able to control your pelvic floor properly is all about confidence or lack of, because you're constantly aware. If you have to rush to the toilet all of a sudden, you're a little bit aware when you go out. There are some people who are literally have a geographic map of every single public toilet in Gibraltar.
I know.
For men who've gone, particularly men who've gone through prostate difficulties or had prostate surgery, it's an amazing thing. So, and the nice thing is you can go in, and the clever thing about the chair is you sit there, it kind of electrocutes your pelvic floor. Let's be honest, that's what it does. And it does it brilliantly because it kind of constricts your muscles. But while you're there, actually, a lot of people go, you know what, while I'm here, I've always wanted to address the creases in my face, or I've always wanted to actually look a little bit more at my, at perhaps a little layer of fat that we always carry around our bellies or things like that. Or I've always wanted to deal with some other cosmetic issue. While I'm here, can I talk to you about it? The team that work there, very, very professional, very, very knowledgeable, and can sit down with anyone that walks in the door and just say, try this, let's do this. It's not the hard sell. That's a very clever thing about it.
I really recommend going. And one last thing, because we're nearly out of time. Have you tried the spa? Have you actually been in the E1 spa? Well, which is where we are today.
I know.
I mean, the apartments are really nice. The views, as you can see, are beautiful. But then the spa is fantastic. It's a real treat.
And you know what? I've been to a few spas in the kind of local Spain area, to the point where I even went to one in as far away as Almeria. So 3 hours drive to get there, which is very beautiful. And what's interesting is that this one,
it's probably nicer,
really
no?
reminded me. Yes, because I walked in the door. It's very calm. Beautiful. It's very tranquil.
Yeah.
Just it's warm.
Wonderful.
It's got all that you could want from a spa, and the best thing is, it's on our doorstep.
On our doorstep, and the pool. I like swimming when it's pouring with rain outside and cold.
Yes, very true.
I come here and I can do lengths. It's 22 meters, so
I know, exactly.
It's really good. So you can practice your lengths.
Particularly in the winter.
Yeah.
Sometimes, you know what, when it gets to December, January, and that little chill gets
you don't really want to go
sometimes
into
you
the
just
sea.
like,
No, of course not.
It doesn't look so inviting, the sea at this time of year, does it? But
Absolutely
sometimes
not.
just as a treat.
Yes.
Why not just, warm up a little bit, even just go for an hour. And the funny thing is, of course, a lot of us feel like we can't or we shouldn't. We shouldn't spend the money that...
But we should, Krish.
Yes, I agree.
Absolutely.
Yes.
We are very important.
Yes, yes.
I think people, I know you're trying to say people feel bad.
Feel bad about spending a little bit of money and spending a little time.
Like being selfish.
Particularly actually if you've got a busy family life and
Yes.
you feel like you're going, you know what, I'm going to spend a little bit of that family money and a little bit of family time on myself. But never forget that particularly work, family, they depend on you being well.
Yeah.
They depend on you being physically well, mentally well. And if all it takes now and then is just a little spa treatment, just to reset everything.
Yeah.
And maybe those aching muscles from being in the gym regularly 2 or 3 times a week.
Go for it.
Yeah.
Krish, thanks so much
Pleasure.
for joining me. It's
No, it's
really
great.
nice to hear everything that you're doing.
Yeah.
Keep going.
Yeah.
What's the next project? You've just been to Costa Rica. You've climbed up a mountain.
I think the next project is to stop my aching legs from the climb. It was amazing. Yeah, I mean, but it was a proper trek. One of those where you have to work hard. And I love my exercise. I love my fitness, and I did a lot of training for it. And so there was the amazing thing was we stood on top, and I actually felt the benefit of all the training that I had done leading up to that, particularly for the legs, the swimming, the treadmill work, the leg work, everything. I actually felt it. And it's an amazing thing to think, look, I've achieved this because I've exercised every single day.
It's a good feeling.
Yeah, amazing.
Yeah.
So I'm not sure what the next project is at the moment. I think I should just calm down for a minute and then
have a nice treatment at the spa.
At the spa, exactly right.
Thank you so much for joining me and for telling us all about it. Okay, we'll see you soon.